All right, let's get started. I'm not in the class. Thank you for joining us. My name is Maiyia, and I am a community planner at the Minnesota Department of Health.
My name is Tuesday Glover, and I am the director of the culturally responsive caregiver support and dementia services team.
And I'm Betsy Meyer, Director of Programs and Partnership Development with the Remember Project.
Just a quick show of hands. If you identify as a caregiver, how many of you identify as a caregiver? Okay, how about half of you? And our hope is also that with the information that we're sharing with you today, you'll be able to take and use some of it, right? Either through resources or I'll be sharing some data as well. Next. So I will start off with sharing kind of the work that we're doing with the Department of Health around the Healthy Brain Initiative. And then I'll share some caregiver data. And then I'll hand it off to Tuesday and Betsy to talk about the work that they do in organizations. Next. Next slide. So with the Minnesota Healthy Brain Initiative, it's focused on Alzheimer's disease and related dementias. Currently, we're being funded through a 5-year funding cycle from the CDC on the BOLD grant. So the BOLD stands for Building Our Largest Dementia Infrastructure. We also have some funding, some state legislative funding for an Alzheimer's awareness campaign. So that's one of the other things we're doing in addition to the work that we're doing through BOLD. We are partnering with organizations to support and expand the dementia-related work that the organizations are doing, as well as connecting key partners who are doing this work across the state. We have 4 goals. Our first one is to expand the efforts to prevent dementia by addressing dementia risk factors, so like the modifiable risk factors. And then the second one is to improve detection and screening for dementia. The third one is to ensure that people who are living with dementia have the support and services that they need. And then the last one is to enhance support for dementia caregivers and care partners. There are several different activities that we have categorized under the Healthy Brain Initiative. One of them is the Minnesota Healthy Brain Partnership. And so this one is a partnership, it's a collaborative of different organizations, stakeholders across the state who are doing work around dementia. And we worked with the Healthy Brain Partnership to develop the Minnesota Dementia Strategic Plan. The strategic plan came about with just really looking at a lot of different documents, right? CDC documents, as well as like state aging plan and other organizational documents, and looking at the strategies and priorities. And so really doing like a matrix crossover map of all of that. And that's kind of how the strategic plan emerged. We have 3 work groups, like sub work groups that are part of the partnership. And the first one is the community work group. So this community work group is looking at community-facing initiatives, activities, things to implement that can be implemented under the Minnesota Dementia Strategic Plan. Our second work group is community clinical linkages work group, and this one is actually being developed right now. So this one hasn't met yet. And then our third work group is data to action. And this last work group really is looking at the data and figuring out how do we translate that to things that we can use. How do we translate it to policy, to programming? So that's what that work group is doing. And then we are partnering with Volunteers in America, and you hear more about it today. And then we're funding for Healthy Brain community grantees, and one of which is with the Remember Project. So these are the activities that are happening in the Healthy Brain Initiative. And so with all of the different stakeholders that are doing work, right, around dementia, it's important that we understand what our role is in public health. And there are 3 main things, right? So the first one is to convene and connect communities and stakeholders. And so we do that by having community forums, keeping work groups. And then the second one is to promote healthy living and chronic disease prevention. So we do that a lot by communications, with our communications campaign, to sharing resources, tabling at community events. And then the third one is to increase the visibility of the support community organizations. And so we do that by, our partnerships and our grantees, as well as co-presenting with our community partners. So identifying times, places, and areas, audiences that we can help amplify the work that our community partners are doing. Next slide. So this next piece here, I'm going to share and give you some information, some data around caregivers in Minnesota. But before I do that, just giving you a quick definition of how we're looking at or defining caregivers and care partners for this particular presentation. And really it refers to generally unpaid informal caregiving by family, friends, and neighbors. Someone who provides support and care is really a partnership. So the person who's receiving care is an active participant in that process. Next slide. So there are two data sources. The first one is the Minnesota Behavioral Risk Factor Surveillance System, or the BRFSS. This data is from 2021. It's an annual telephone survey, and it's a statewide sample of approximately 15,000 Minnesota adults. The second data source is the 2022 Minnesota Dementia Partner Survey, and this one was launched and put out by the Minnesota Department of Health. This one looks at organizational level data. So we did this with convenience and snowball sampling, and 175 organizations replied to this. Next slide. So when we look at the numbers of caregivers in Minnesota, the folks get to identify whether or not they're a caregiver using this BRFSS question. So during the past 30 days, did you provide regular care or assistance to a friend or family member who has a health problem or disability? So it depends on how we respond to this particular question, is how we're defining caregivers. And with that, 1 in 6 Minnesota adults, or around 750,000 people, identify as being a caregiver. And then one of every 8, or around 100,000, reported being a caregiver for someone with dementia. And so you'll see that there are other numbers, percentages around like the number of caregivers in Minnesota that will vary, because it also depends on how caregivers are being defined and the data source. So I'm just letting you know that these numbers are coming from this particular data source. Next slide. And what we're learning is that most caregivers are females and between 45 and 64 years old. And in Minnesota, about 85% of caregivers are caring for a family member. And in this table here, you can see that caregivers who are caring for for people living with dementia are more likely to provide support for a longer period of time, so 5 years or more. They work longer hours, so more than 20 hours a week. And they do a lot more of the personal care activities, such as bathing and dressing. Next slide. Minnesota caregivers are also more likely to be living with chronic disease compared to non-caregivers. And in particular, dementia caregivers are even more likely than caregivers who are not dementia caregivers to have a chronic disease. So here in this table, we've identified the different chronic conditions and comparison between Minnesota caregivers and non-caregivers. When it comes to mental health, Minnesota caregivers are more likely to report having 14 or more core mental health days per month compared to non-caregivers at 16.5%, at around 70% versus 11%. And the conditions or mental health categories that they're looking at are history of depression and smoking. So as you can see, the Minnesota caregivers are more likely to have a history of depression, are more likely to smoke compared to non-caregivers. Next slide. Minnesota caregivers are also reporting that they sometimes rarely or never get the social and emotional support that they need. And if you break that down by racial and ethnic communities, Black or African American caregivers, and likely additional racial groups do not have the adequate social support, social and emotional support that they need. And then, so this information that is from the Minnesota Dementia Partner Survey, really looking at that organizational level. So now that we have an idea of the caregiver data in Minnesota, what services and support do we have to support these caregivers, right? And we learned that nearly 4 out of 5 direct service provider organizations that address dementia are offering or plan to offer services and supports for caregivers. Right. And about 84% of direct service organizations offer caregiver education, and 59% offer caregiver support groups. So here's just on this table really showing the different type of caregiver health support services that organizations are identifying that they either have or planning to have programs for to support caregivers. And then direct service providers also want to expand services to address mental health. So they do recognize that they need to provide, in addition to other types of caregiver support services, mental health support services for caregivers as well. About 41% have or plan to have counseling or caregiver consulting. About 40% individual therapy or mental health services for dementia caregivers. About 32% have caregiver support groups. Some organizations are integrating whole person approaches. So when they're really looking at caregiver support services, they are approaching that from a whole person perspective. And they do that by developing and using culturally responsive strategies and services, community health workers, and assessing client social needs. So as we look at how do we support caregiver well-being, I think the first step really is to identify who the caregivers are. Because we know that as caregivers, your role, there are social determinants of health, right, that really impact your role as a caregiver. And there are, conversations about potential being a caregiver is a social determinant of health, right? So, so if you look at it from that perspective, it's important to identify, as we identify other types of social determinants of health, if caregiving would be one of those ones. And so it's important then to look at, whether or not someone's a caregiver to assess, what support services they need, and then to look at their health conditions, the chronic conditions, mental health, as well as, providing the needs that caregivers need through creating culturally appropriate whole person approaches. All that I have. No, actually,
Next slide, please. All right, let's start off by introducing our team. We have 2 social workers, myself and Bianca, and then we have community health workers, Talana and Deborah. And then we have a project coordinator, Lufelia. And we have 2 African-American CDL drivers. They drive the mobile clinic, and you'll see that a little later. And then we have Keisha Hazel, she's our registered nurse. Next slide, please. And that's some of our team. That's an old picture, but I'll put it on it. Next slide, please. This is our video, and you will get a copy of the PowerPoint, but I'm not going to show this right now. I'm just going to try to tell you what we do instead of show you. So our program mission is to showcase culturally responsive caregiver support that can help you to improve your health and well-being by providing a wraparound, the whole person, as Maiyia mentioned, in-person approach healthcare. So we're going into the community and doing healthcare. Next slide, please. And another one of our missions is to go from communities that are experiencing health disparities and creating health equity. We want equal access to health care for all. I mean, we can't do it all, but we're gonna try. Ours we can. Next slide, please. So our vision, we talk about culture. If we do, I tell my staff, if you do a good assessment of the person, you'll learn really what their culture is and just listen. So active listening, going in with the intention of learning something, and throw your biases out the door. It's not the way that you do it, it's the way that they do it. It's kind of their word. So just active listening, just listen closely, never assume. We introduce stress management tools for caregivers, and it's key. We'll talk about that a little bit more. Health education to the dementia caregivers, communities, and older adults. And organizations, they ask for health education, dementia education too. Brain health education, because there is no cure for our community, as it come into our community yet, because of finances or what have you. The risk factors are key to avoid being proactive for dementia. So we educate a lot about the risk factors for dementia. And we address the whole health. We talked about that. Maiyia talked about that. For caregivers, older adults, everyone that we come in contact with, we try to address the whole health. I mean, I always tell this story of somebody diagnosed with diabetes, for instance. So they have diabetes, but how do I eat? You haven't addressed that. Is this mentally making me depressed because I have diabetes? So addressing all areas, social determinants of health. What kind of food? Where can I get food? So just talking about every aspect of the disease for that person, not just the disease. And then educate them about the disease so they'll know, what are some things I can do different to be in good health, better. Next slide, please. The population we serve are caregivers, care partners, older adults, elders, African American with chronic illnesses. It's the BIPOC population. Anyone in our community with chronic illness, organizations working with dementia. Community members living at or above 150% poverty level. When there's no money, there's usually lack of resources in the community. So, and then we have culturally sensitive resources. I actually have my staff research resources in our community. So you find a food shelf. I would like for them to go and check it out before they give the resource to our clients. Because sometimes they might have closed during COVID, or what else? Rental support. And check it out real thoroughly before you pass it on. We serve older adults of color, living alone that have been diagnosed with chronic illness or dementia, or they just may need resources and need some services. So in-home services is another thing. I didn't talk about this, but a lot of our clients need in-home services. They can stay in their home for as long as they possibly can. Next slide, please. So Maiyia just asked, but I'm gonna ask another question. How many of you heard of a memory screen, or have you had a memory screen?
Or if you've heard of it, or
Yeah, have you ever heard of it?
yes.
Okay, okay, good. So when we go to the doctor, it's usually 50 plus. You guys look really young, but 50 plus when you have your full physical, they're supposed to ask you to, have you had a memory screen? And can I do a memory screen? But a lot of times they don't. So you have to advocate for your brain. So I call it check up from the neck up. They'll put you on the scale. They want to know how much you weigh. They want to check your heart, but the heart is just as important as the brain is just as important as the heart. So please advocate for a memory screen. They should be done annually after age 50, 55. Early onset is on the rise for dementia, so I suggest people ask them, just advocate for it. It only takes like 10 minutes of your time. Next slide, please. So a lot of our caregiver support services are respite. We do coaching and counseling. We do family meetings. We have caregiver support groups that are culturally appropriate, culturally sensitive. What else? We have a slew of resources. We connect them to evidence-based education. So that could be powerful tools or reach some dementia education. So it could be the whole family or just individual. Next slide, please. Some of our interventions, we promote social and emotional support. We do that through we have a lot of online programming. Then we have in-person programming. We just had a brunch and for caregivers, we did a caregiver appreciation and invited all the caregivers, and a lot of the caregivers like to volunteer. So we called it caregiver and volunteer appreciation. They had lunch, and then we had spiritual health as one of our programs. So they talk about different scriptures in the Bible and just have a good old time. And it's like caregiver support for them. It relieves stress for them. So we continue to do the caregivers. We call it caregiver support too. So spiritual health, caregiver support, and the clients love it. We always have a big group for that one. Dementia education, do a lot of that in the community, in our office, one-on-one, on the mobile clinic. We do it at Minneapolis Public high rises. They have an annual member screen. Annual dementia education that they have to do. And so we go in and we do that dementia education for all those staff. So they can know what dementia looks like, how to communicate with somebody with dementia. So if they see it, then they'll know to do a referral. We teach about stress reduction. As we caregiver, you don't even have to be a caregiver. Stress, we're going to be stressed. And we talk about what that looks like, what that feels like, and then what some interventions you can do if you're stressed or have depression. Knowing that self-care is not selfish. We keep talking about that because caregivers feel like they can't take care of themselves as they care for their loved ones, and we have to tell them caregivers expire before the care receiver. So you have to make sure if you're not taking care of yourself, so you have to make sure that you're taking care of yourself as a caregiver. Because if you're not around, who's going to take care of the person with dementia? So just having that tough conversation. And then respite services. It's hard for us to promote respite services if we don't have someone to watch. It's hard for us to promote self-care if we don't have respite services, because the respite's going to give them some time as we sit with their loved one to go get a haircut or whatever it is they like to do. So, and we just got funding for that. So I'm so excited. So we can see more people taking care of themselves or caregivers. Next slide, please. We have community health workers that walk alongside. They join alongside our social worker and the care partner, caregiver family. It's usually a family. So they go in with the social worker, and the social worker does the initial assessment, but the community health worker goes in and identifies resources that the family may need, health concerns. They'll do blood pressure right in at home. We can have our registered nurse go in and also do glucose and cholesterol checks right in the home. So a lot goes on with the community health worker and the social worker, just bringing a wellness to the family. Next slide, please. Dementia education. So we're doing a lot of dementia education. I mentioned this before, evidence-based training. Community health workers have completed the DHS, what's it called? Dementia Capability class online. Sorry, I had a brain freeze for a second. And they get a certification for that. So I'm excited. So they can go and teach our community about dementia. Next slide, please. So this is what dementia is. So often dementia is confused with Alzheimer's. So dementia is the umbrella for Alzheimer's. That's probably all of this. I just make sure that I put it into my PowerPoint because some people will get a little confused about the differences. So there's flowers, different types of flowers. There's dementia, different types of dementia. And there's many types. These are just a few. There's many of them. but Alzheimer's happens to be the most diagnosed. And vascular is the diagnosed in our community of color, is we're twice the risk for having hypertension and diabetes, so that's the one. And like, we see a lot of early onset frontotemporal too, so early is 40 to 50 years old. Next slide, please. So we do outreach, person-centered approach. We're in North Minneapolis, South Minneapolis and the outskirts, St. Paul. Next slide, please. We're a community organization, churches, spiritual organization, mosques, schools, colleges, and community courts. Next slide, please. So we're the bridge between healthcare and the client. So we're learning with our population that a lot of the seniors don't go to a doctor. And we advocate the importance of making sure you go to the doctor, not make the emergency room your main access to healthcare. That's what we see a lot of. And after the education piece, they see the importance of making sure they get there, but connect them to culturally appropriate clinics in our community, and they feel more trust, I guess. So we do vendor tables, we do blood pressure outside, anywhere. Virtual platforms, we have 9 of those that talk about dementia education, brain health. Our CHWs do the follow-up calls, like we're at an event. We do health fairs, and at the health fair, we're doing blood pressure, diabetes, education. And if we find somebody has 200 over 100 blood pressure, that's extremely high. Our community health workers will follow with them, do an assessment, and try to get them the help they need so we can get that forward. And if it's ever that high, we set up an appointment with their doctor right away. We can't let them leave the facility with their blood pressure that high. So that's one thing that is a red flag. We engaged in the local government to address caregiver needs. So we were at the Capitol and we advocated for more respite funds, and we actually got it. I'm excited about that. And we continue to be at the Capitol for community health worker funds. We can do the boots on the ground, do the work on the ground, but we also have to have someone advocating at the policy level to make sure that the money. Next slide, please. And this is our mobile clinic. And it's out in the spring and summer. So this is a busy time of the year for us. There's 2 clinic rooms in there, bathroom, waiting room. Next slide, please. These are some of the services we provide on the mobile clinic. Memory screens, we assess for risk factors, blood pressure, A1C, cholesterol, PHQ-2, and then a 9. That's a depression assessment, dementia education, as I mentioned, brain health education, connect to community resources, assess social determinants of health, and promote healthcare directives, because that's another issue that we're having in our community. We don't like to talk about end of life, so trying to neutralize and normalize having that conversation, get rid of the stigma of whatever happens in this house stays in this house, and connect people to our community therapists that we have connections with, and they look like us. So that's that trust. People are more apt to go to people they look like and talk like, and So. Next slide, please. Ways we are proactive for this vicious disease is we advocate for annual memory screening. We educate the risk factors. We talk about brain healthy diet, green vegetables, and less sugar, less fat. 150 minutes per week exercise. 30 minutes a day. Just elevating the heart rate. No aerobics, you don't have to jump to the ceiling or anything like that. Just you could be in a chair and get your 30 minutes a day done. And then an issue that we're having, and people are, first, they don't recognize they're a caregiver, because culturally, this is what we do. But after you explain that you are indeed a caregiver, and you want to call them their care partner, okay. And then recognizing that the job is stressful, and you may be stressed. So what are the symptoms that you're experiencing? And then just educating them what it looks like to have depression and anxiety and mental illness. So yeah, just having that conversation. It's a tough conversation. And then introducing some stress management tools like mindfulness, deep breathing, And some people like to journal, some people like to exercise, walk, whatever it is that they like to do to regulate. Next slide, please. Brain health, we talked about this in the community education brain health. Next slide, please. So a lot of the topics for risk factors for dementia. We talked about COVID and brain fog, hypertension, diabetes, isolation. Those are our key risk factors we talk about all the time. And just ways to be proactive, diet, exercise. Next slide, please. And thank you.
You can go ahead and start. I am. Thank you, first of all, for having us today. I'm Betsy Meyer, once again, with the Remember Project Director of Programs and Partnership Development. And it's been just a complete pleasure and honor to work with Maiyia from MDH and the Bold Initiative, as well as more specifically the Healthy Brain Initiative, and getting to know and working with Tuesday and her team. It's like a breath of fresh air all the time. The Remember Project, next slide, please. The Remember Project, our team of thought leaders and artists are pragmatic idealists. And we work in careful partnership with organizations and agencies to address multiple outcomes related to dementia. Next slide, please. To increase awareness, next slide, dramatically reduce stigma. Next slide. Address and reduce fear. Oh, these are going to completely. It's okay. Open conversations that can shed a light on and reduce isolation and loneliness. Help individuals understand risk factors so they can make choices to reduce those factors. Talk openly about brain health. In many cultures, there's not even a word for it. To promote normalized regular memory screenings. To help our audiences embrace the value of early detection. And how do you detect something that there's not even a word for and you can't talk about? And to connect people to resources long before families find themselves in crisis. We focus on all these things and more to help those living with a dementia diagnosis and their care partners have the biggest lives they can for as long as they can. Managing their journeys with dignity, self-care, and purpose. Our program began in the fall of 2015 with a pilot project in the lower St. Croix Valley, which is near Stillwater. Over the course of 10 weeks, we delivered 33 events in 15 communities featuring 3 of our plays. Our goal was to merge an arts engagement model with in-depth community conversation on the difficult topic of dementia. To become a dementia-friendly community, next slide, please. To become a dementia-friendly community is no easy thing, especially due to the fear and stigma related to cognitive decline. You don't want to talk about it. How do you recognize it? Most people avoid this topic as long as they possibly can. Next slide, please. Our program model is very straightforward. We like to say we are borrowing this topic from this model from the ancient Greeks. They did it best using the theater model and community conversation. So we're relearning how to do this. Our program model is very straightforward, and all events, even our virtual events, have 3 distinct components: a gathering time, a time of formal welcome, where we also watch a short play together, and a time for community conversation, which is the heart of a Remember Project event. During the community conversation, our trained facilitators guide the audience through 2 or 3 rounds of small group discussions. We give them topics to talk about related to what they just experienced during the play they just viewed. Between rounds, we debrief as a large group, providing the audience with the opportunity to share their insights, ask questions, and make connections discovered together through authentic conversation and frequently self-disclosure. During the community conversation, one or more local subject matter experts stand ready to answer questions that are specific to a clearer understanding of brain health, resources available to reduce the risk of dementia, and avenues for support for those living with a diagnosis. Resource tables are extremely valuable at live events, and resource links and mailings are essential for virtual events. Next slide, please. This will happen just randomly. We've delivered the Remember Project event over 300 times, predominantly in Minnesota and Wisconsin, though in other states as well. And every community conversation has been a time of rich sharing and collective understanding. Audience feedback continues to reinforce the positive impact of the program. 98.9% of our post-event evaluations note a highly positive impact for our attendees. We welcomed thousands of attendees from 38 states and 3 countries. Next slide, please. Our past partners are enthusiastic about all the ways we support them during the event planning, delivery, and evaluation stages of our work together to deliver community events that are free to audience members. Program costs are frequently covered by any combination of existing budgets, sponsorship supports, grants. We help our partners work through that cost. A partnership with the Remember Project entails thoughtful planning together, where we define the scope of our work. We establish the service area. How many other partners do we want to bring in for this collaboration? And identify short, mid, and long-term goals. In some partnerships, we deliver just one program at a time, and others are designed from the beginning to deliver multiple events over the course of 3 to 6 months or longer. We've been in a partnership with a rural Minnesota community in Southwest Minnesota for almost 3 years. And we've visited some Wisconsin communities multiple times since 2014. The best way to work together is through a regional approach, which helps the maximum number of audience members of all ages to participate. This approach can include, next slide, please, programs for the general public, programs for target audiences such as youth, first responders, faith communities, service organizations, healthcare workers, chambers of commerce, and educators, and programs that support professional development or conferences like this, many of which have included the option for continuing education credits in social work, nursing, emergency services, and more. Next slide, please. Partnerships move through the planning process with a hosting team and also include beautiful branded marketing materials, such as social media headers, digital flyers, postcards, and posters for partners to print and share on social media, press releases, and a virtual box office for event-specific information and registration. Our team is always happy to participate in radio and television interviews, and we also provide support when needed in securing funding partners. We are happy to do that, as a matter of fact. Next slide, please. Finally, we provide an event feedback and evaluation process that helps our partner organizations assess the value of our collective work and report back to their supporters and funders. Next slide, please. The Remember Project was last year recognized by the National Organization of Arts and Health for our effort to create a virtual program delivery format during the pandemic. We pivoted from a live events to a virtual format. A format that continues to serve audiences well. So now we are able to do live events, virtual events, or hybrid events. This 2023 Noah Camblick Award was in the category of Arts for Innovation. Over the past few years, our work continues to expand to live in our promise to reach all people including marginalized communities that disproportionately are impacted by dementia or do not have easy access to information. These include community members who have hearing and vision impairments, who are at increased risk due to social isolation, and to those for whom English is a second language. We are partnering with the Office of Deaf and Hard of Hearing in Wisconsin. We have adapted one of our plays. We have 2 deaf actors who are currently in rehearsal stage. We will be sharing that play in the deaf and hard of hearing community throughout Wisconsin. And thanks to funding from Minnesota Department of Health, we will be expanding that. We are looking at expanding that into Minnesota as well. English as a second language. We are partnering with any number of organizations and groups and communities throughout Minnesota, Wisconsin, and beyond in a very culturally responsive way to help them receive information in a way that makes sense to them, to help them be in conversation. We want to help them talk about this topic. It's important to us. The arts are a powerful tool for helping people enter into difficult conversations. And it's been incredibly rewarding to stand with our partners who work in the fields of aging, public health, community service, as we join together in the Dementia Friendly Communities movement. And if you'd like more information, the rememberproject.org is filled with terrific information. You can also find us on YouTube and Facebook. So we now open this up for questions from anybody. Yes.
I just had a question for you on
Yeah.
that. Like, where do you curate the plays from and the actors and stuff like that?
Yeah, so we use professional actors. And we do that depending on if we're doing live events. We have a pool of actors that we pull from that have rehearsed into specific roles. Sometimes they can't travel with us. We were with Tuesday and her group, one of her caregiver support groups at Christmas time. We brought in an actor from her community that helped us with the event at her venue. So it really depends. As far as curating the plays, sometimes the Memory Care Plays Anthology, a book that you can find online. That's what started the Remember Project. It had been entered into a play writing competition, and a group of people, including Jeanette McCarthy, our founder, were really impressed by it. And so the 3 plays that are in there are part of our repertoire. However, other plays have come into our purview. Many of them are written by white playwrights. However, not all of them. And so we are really happy to be expanding what we do, how we do it, and look at it through the lens of culturally responsive programming.
Are you based in Minnesota?
We are based out of St. Paul. So the Remember Project lives at Trellis, which is the metro area agency on aging. It serves the 7-county metro. However, Trellis has a national footprint. It is throughout Minnesota.
Okay, and the name of that book again?
The Memory Care Plays Anthology. Other questions for any of us? Yes, go ahead.
A question for Tuesday. I was just gonna ask about the mobile clinic, like, where, how often or what, how accessible is that? Or can you talk a little bit about the mobile clinic?
Well, let's see, in October, kind of wind it down and not bring it out so much. We will do October because of the snow. So when it comes to November, December, January, we're excited when March comes because we have our first health fair, usually the 4th week of March, and then we keep going from there. So on the average, we bring it out like twice a month.
That's amazing.
Yeah, it looks like it. Yeah.
We even done some work with St. Paul Public Housing and Indiana Public Housing. And people are interested in just to get health screens. So we'll bring it in front of their apartment building and get like 25 people and get a full, well, not a full, blood pressure. We'll do some labs, education, resources for them. depression assessment.
Do you ever go to other just organizations with your, like, I'm just thinking of like interfaith outreach and that one.
So, we have health fairs that, we're officed in a church. So one side is the church, one side is the office. And so they're asking when we do our health fairs there to bring local clinics, so we do that. We're with the Altar program, so and that's a spirit-based program is, yeah, faith-based, I'm sorry, program that does a lot of dementia education, connect caregivers to support. So we bring our mobile clinic there as well. And then there's community events that we're going to every year.
So you don't go too far out in the metro though, just.
It depends. It's kind of first come, first served. So we're getting a lot of offers to have it, but we're getting full on June, so July is almost there. So yeah. People try to book it the year before for the next year.
Any questions?
I'm curious, like, if, yeah, this is question for Tuesday, during the memory screens, are you guys ever kind of like adapting those screens to be more, appropriate or just like, applicable to that person and their environment or their community, or is one thing, like, at least, in our work is, sometimes the language isn't always like, doesn't fit everyone. Sorry, that wasn't the end of the day, my brain is.
What population do you serve?
So, us three, we're with Memory Keepers, medical discovery team, so we are with, we're a research, but, or the populations we are working with are rural and indigenous, and sometimes, the screening questions, don't always like makes perfect sense, or is that applicable, and, maybe the way you approach those issues might be different with different kinds of people, and I guess what my question might be more around, like, how have you and your staff sort of approached that with your clients, and.
So what happens is, we were coming back after doing memory screen, a lot of our clients were not passing the screen. So we met with the creator of the Meiyia, Dr. Sue Wilson, and she gave us some suggestions, but we went to the drawing board with our neurologist, he's an African American neurologist, and created a culturally sensitive screen that everyone across the board can take, and it addresses more of the risk factors for dementia. And then we had to create a second part, it's the brain health test, comparable to Meiyia, but it's more culturally sensitive. So you are not asking for words that are not in different languages that they don't recognize. So we had to find these words that are recognizable in all cultures and put it on the brain health test. And so now that we have it, it's been working. And then we also have one for people who can't hear or can't speak or what have you. And it's a hand movement. So we do those three now. And then there's another one called actual naming. So we do that quite a bit too. So we had to go back to the drawing board and create some culturally appropriate instruments.
Oh, wow, yeah. Cool, how long did that take you to have to like?
Oh, it took a while.
Yeah.
It took a while.
Yeah.
We're so appreciative to have it. So we go in, they didn't, it's just that they didn't understand. It's not that they failed screening. So now we can get good response pretty much in yeah. So I'm so glad that we were able to do it. It was some funding that I'm glad it came at that opportune time to do that.
Yeah, that's really cool. Thank you.
Yeah.
We are at time.
Yep.
Yeah, and so I think these slides will be shared with you, so you have access to them.
Thanks for joining us.